So here we are discussing civility. Civility Matters was your project, right? Dr. Brierley, Yann,
That's right. Yeah.
you're a pathologist in interior health, is that right?
Correct. Yeah.
Yeah. Sujatha and I are family doctors here in Surrey, and we're really interested in learning more about civility. And I think you had just said earlier that um, that in civil or non-civil behavior does something to decision making in clinicians. Could you mention that again?
Yeah, for sure. Yeah, it's and just to reiterate, the what we're talking about here is the mild to moderate forms of rudeness, right? Not the overt stuff like the harassment and bullying. This is the stuff that happens on a daily basis, the microaggressions, the stuff that flies below the radar. You weren't quite sure what was intended. It's ambiguous, and sometimes it's intent to harm. Sometimes it's intentional, sometimes not. Um, but it's those very things, those very events that can happen on a daily basis that can get in the way of our ability to function at our very best. So our team performance is impacted. And I think, know how it feels in the moment when it's directed at us. We feel crappy, kind of are wondering what's going on. But there's actually real data behind this stuff now that's really compelling. And that's what really drove me to look at this project in an earnest manner. So um, there's on the recipient side, there's a 40% reduction in your cognitive capacity. You're 40% less effective in your job. And this can impact the recipient for up to 8 hours after the event as they're rehashing it over and over in their minds. And 80% of people exposed to this lose time worrying about it. That's all they can think about, right? That's all they can focus on. And now they're distracted. You can imagine how errors can creep in that ordinarily would never happen if you're on your game. And in the healthcare business, it's the patient that can take the hit. And so if we're patient and person-centered, care-oriented, this really speaks to a big piece of that, right? That how we show up and how we interact with one another really impacts care. And then I'll just add one final thing, Lawrence, that when you're the recipient, you are then 50% more likely to not show up the next day for your shift or work, right? It's maybe a little less for physicians, but non-physician staff, they're like, no, I have the option and I won't show up to work. So, this compounds staffing shortages, certainly. And so that's all on the recipient side. If that's all bad enough, there's an impact on the witness as well. So even just a third-party witness watching a bad event, they're 20% impacted from a cognitive standpoint. So their bandwidth is reduced as well. So 40% if you're the recipient, 20% if you're the witness. And then they are, as a witness, 50% less likely to help. They're less likely to offer their time or make resources available for that person who comes around the corner and asks them a question. Can you help me? They're 50% less likely to do so. So yeah, those are the numbers that really stuck out and spoke to me when I listened to the TED Talk by Chris Turner.
Okay, Chris Turner's TED Talk, and it's just about witnessing, almost like the energy created by not being civil or being rude to another team member in the healthcare context could reduce the effectiveness of the team significantly. Is that what you're saying?
Yeah, exactly right. Yeah, and I got involved in this because I was hearing reports as the department head for lab here at the Vernon Jubilee Hospital that frontline staff, lab staff, were being mistreated by hospital staff, right? The very staff that they felt they were a part of and the team they were working with. So that was hard for me to hear, and I just felt like I had to do something or look into it. And just knowing what I knew after watching that TED Talk in particular, I just felt I had to try to do what I could to make sure that more people knew about this.
Wow. And
Yeah.
Sujatha, you had said something earlier about something that you experienced in your clinic. What was that again?
Yeah, I was reflecting on a time when there was a commotion at the front desk and someone was not satisfied with maybe their appointment time and had made a big ruckus, a big a big blow up basically. And we're seeing patients in the office, and we'll step out and kind of try to help to deal with this. But what ended up happening is that another patient had witnessed this event. And when I had seen her, she was visibly distressed. She was kind of shaking. She started crying, and she just said, I can't believe I had seen that outside. And it was really difficult for me to pull her back and kind of focus on her issue, right? She was just so distraught. And so I just think the science of what you've explained to me just made so many things make sense now when it comes to the human behavior. And I think, Lawrence, you mentioned that emotional contagion and how it can just really move the particles in the environment, either negative or positive.
Oh, for sure. Yeah. Yeah. And you can imagine who gets drawn to healthcare as a profession. It's those who are empathic, right? Who want to be there, who want to help where they can. And data has been shown to reveal that it's those very empathic people who are impacted the most by bad behavior. So we're almost setting ourselves up, us empathics, the most by being in an environment that's frankly less than ideal. Right. And we want to be there for the patient. We want to provide the very best for them. But sometimes, daily interactions can get in the way, those relationships, those less than ideal relationships.
So it sounds like Chris Turner's TED Talk talks about episodes of rudeness. Are these the same as aggressions or microaggressions or verbal violence? Do you have categories of behavior that you've seen in the literature, Dr. Brierley?
Yeah, it's hard to nail down it's all, let's face it, rudeness is all in the eye of the beholder, right? It's like what I may say, I might not intend to be rude, but that's irrelevant. If it's landed poorly on the recipient side, it was rude, right? So my point is, what's mild, moderate, and severe can differ on the recipient, right? What they've been sensitized to, certainly, if they're used to getting more than the average dose of microaggressions during the day, that can all add up. But he does very much make a point of taking this out of the realm of the hostile, overt, in your face screaming. Like, obviously that is completely inappropriate, and that then gets escalated, no questions asked. Everybody's appalled. It's those mild to moderate forms of rudeness where you kind of look around and go, that really happened? Oh, I guess it's okay. We'll just move on, maybe, right? So part of this is tooling up the staff to have those assertive conversations and to dispel that permissive environment that we're in, right? That, oh, that's just the way he is or she is. That's how they deal with stress. Well, no, like maybe they need help. Maybe they need more conversation around how they can better interact with those in times of stress, right?
It's almost like the incivility or the rudeness that we tolerate, that we let slide, is kind of like the rudeness and incivility that we support in our culture.
Yeah, it kind of gets condoned, right? What you ignore gets condoned because you have a bad event, or sorry, as let's say the aggressor, you make a comment, nothing happens. You feel a little bad about it, but then nothing happens. So, okay, that's tolerable. And so you kind of get in a bit of a mode of, well, that's tolerable. That's okay. I can continue doing that. And it's if you like, jarring people out of that mindset, going, no, it does have an impact. And if you're not sure if it had an impact, ask, just, check in. I want to make sure, like, I'm worried that what I just said didn't come across the way I intended. Are we still good? Just having that, and the recipient might go, oh, I didn't even notice. No, we're totally good. Or they might say, geez, I'm really glad you asked. because it did kind of bug me, and I'm having trouble formulating how, but the fact that you came to inquire as to my, well-being and how I'm doing, that really means a lot. So talk about, building up the team from that perspective.
Yeah, it opens up some good conversations if we have the self-awareness to ask for those conversations.
Exactly. Yeah.
Sujatha, anything come to mind for you, Sujatha? Any questions you want to ask Yann about his project on civility?
I'm wondering, so you're saying that you go to the staff and you have this kind of education piece. That's what I hear. And then how do you like spread the momentum? I mean, just hearing what you just said already, I'm like, wow, just the science, because of course we like science, that just blew my mind away. Just only the science part.
Yeah, well, it's a great question. I'm a pathologist. I think I care about people and relationships more than most, maybe. I don't know. But I recognize my limitations, certainly. And so I felt that linking up with somebody who's an expert in this area, I'm calling her a civility expert. Her name's Faith Wood. She's a Vernon resident. Having Faith do the sessions with the staff so that it's not, because let's face it, I've had a history with staff. I'm not a paragon of civility or anything, right? But having learned this, I have made a conscious effort to change my behavior. But the beauty of having somebody who's non-IH, non-health authority affiliated, is that she can come in, she has the clout, she has the resume to really have an impact. And she's great because she's ex-RCMP and airline baggage handler. So she's very accustomed to dealing with conflict and knowing what to do and how to get good outcomes from bad situations. So she's been leading the session. So it's been a 3-month project. We just recently did it with the perioperative services here at the Vernon Jubilee Hospital, and survey before the 11 civility sessions that are each half hour, so small chunks at the start of a workday, and then following that post survey. And I was delighted to see that 82% of respondents said that this project had a positive impact on their workplace. So that was huge. I was glad to see that. And with this stuff, it's hard to measure, right? That's the other thing. It's kind of a feeling. It's nebulous, but where it really matters is just how people feel at work, right? And the anecdotes they provide, and those additional conversations that previously didn't happen.
Yeah, it sounds like it's experiential in the way that the workshops are done, because probably everybody's given a moment to pause and reflect. I also see this like EDI, like equity, diversity, and inclusion kind of conversations come up. And I also think it's going to foster those common connections that, the common humanity that we share amongst ourselves, and we sometimes are too busy to stop and reflect. So there's so many, I don't know, layers that are built into this conversation.
But how would you define civility? How is civility distinct and separate? Do you have any diagrams or anything to share with us, or just some words that you use to explain what civility is?
Yeah, we struggled, or I struggled with this. So the word civility has nothing to do with civilization, Western civilization, all of that, but it's unfortunate it's got that semi connotation with that. And kindness is similar to the word civility. But I guess civility I ran with because, well, Chris Turner did, and I have so much respect for him, and it's a good word, it's just not used a lot, right? And because it's one of those opportunities to define it the way you want, because it's not known that much, right? So for the purpose of the project, it's just being very intentional in your interactions with people, both the behavior and actions in your social interactions, like the impact that has. So being intentional,
I like
always
that.
self-monitoring, if you like.
Being intentional and reflective and purposeful. I
Yeah.
think I like that because it shows trust. It shows trust in each person's innate goodness. Because like if you say just be intentional, we trust that the intentions are good in general. That's a very strengths based approach to this. That
Yeah.
Mhm.
Yeah. And I guess at the start, assuming good intent, right? When somebody's coming at you, and trying to respond in a way that's still respectful and kind. And we're not just talking about being nice all the time, right? That's not civility. It's having those hard conversations when you feel like a line's been crossed, or you don't feel comfortable with the situation, right? That's all about patient safety there, right? Raising a voice when you see something a red flag, an early red flag. So it's having that trust and the psychological safety in a work team to have the conversation, so that you hear from everyone, not just the one person who might be the leader or the focus of attention in the moment. That person is still willing to hear from all those who have a different point of view and different, well, eyes on the situation, so that if they see an issue that you might not, because you're a little bit more myopic and focused on the task at hand, then you can hear their voice and course correct, right, and provide the best decision, or make the best decision with all the information at hand, not just what you might think you know. That's
just really tapping into the wisdom of the team and seeing the other perspectives.
Totally.
You had said you wanted to share something on screen. You should be able to now.
Okay, sure. So this is so there's a whole civility package that we've put together as a project team with various posters and templates and such. And there is a roadmap for making civility matter. But before I'll show you the template, if that's of interest, I'll just show you the QR code to the TED Talk. Let me just share my screen here. Code there, and this is just a sample of the posters that are provided to the managers on any department who might be interested in the project. So this started in lab, has gone to perioperative services, had now gone to ambulatory care, and it might find another home shortly. But so that's that one. And then this is just as I say, a roadmap. It's something that's fillable. The big piece to this is that you have an actual problem that's clearly identified. There's a challenge in the department, and there's a sense of urgency. This isn't just something that's nice to have eventually down the road. Yeah, cool. This is like, no, everybody agrees that there's a problem. What can we do about it? So asking these questions and just priming the group. Are you in fact ready for this now, or is this better down the road? That kind of thing. And then who's your project team? What's the recommended composition that seems to have worked to date? Granted, this is a living document and I'm constantly learning. This is by no means fully baked. How frequent we've been meeting, how frequently we've been meeting, and then what the tasks of the team might be. This is the civility sessions themselves, the survey, recommended details about the sessions for length, what to provide the teams that are participating in these sessions, and then the post survey and such. And then looking at project sustainment too. So there are some civility affirmation cards that we've developed. This is just a rough, this is the first draft, if you like, but these are.
There it is. Assume good.
Yeah. So these are things that would have been brought up in the sessions, but in safety huddles, staff can grab a card, flip it over, and read what it says, state what it means to them, and they can get on with their day. It's just a 5-minute little top up, right, to keep civility in people's minds. So there's a whole bunch, and I'll give credit to Faith for many of these. These are sayings and content from her sessions. So
they're beautiful. I love it.
thanks.
You've been hijacked.
Yeah, I'll stop sharing here.
And can people buy those cards somewhere?
Sorry, let me stop sharing. Where's my well, we've talked about maybe doing that. If they are sold, it would be something that would go to the hospital foundation, right, to just funnel back into the better, greater good for the hospital and patients that come and their families. We have them. They're not for sale yet, but at this point, we're just providing them to whoever wants it. Like, it's not about placing any more barriers for this kind of messaging to get out to people. So
that's awesome.
Yeah.
And so, do you already have a spread plan for this project? Is it already spreading?
Well, word's getting out. I was part of the Navigate cohort 2 through Interior Health. So it's for emerging leaders, medical leaders, and it's been a great session. And everybody involved learns how to become a medical leader in their area. But also we're also asked to come up with a project idea, and this was my project idea. And these are physicians chosen by people they work with, be it physician and non-physician, who are spread throughout Interior Health, right? So it can be all the way from Williams Lake to Cranbrook and so on. So I bring this up just because there are people in my cohort who have learned about this and have expressed interest in maybe having it to their sites. Penticton has expressed interest, but whatever. It's early days. To be honest, Lawrence, I'm most keen to just look at Vernon and see what we can do for this site. Maybe provide proof of concept, lessons learned, and then have something that can be provided to other sites. But granted, on the flip side of that, I know that for me anyway, there's a bit of an imperative to this, because I can see people struggling, and I'm sure not every department's the same. Some are worse than others for this kind of culture piece, but if we can get out there and help more and more departments, even if we're not completely ready, let's do it. So be it, right? So
it's cool. It looks like you've developed a kind of a change package, or a package for that people can sign up on, and they'll have kind of a program that they could follow. I mean, they won't all have a facilitator like Faith that you have, but they can make do. They can do it, make it their own, right?
Totally, exactly. Yeah, and that could be the other piece to it, right? What can be done without Faith in particular, or is there someone else in the province, on the mainland, for instance, that could do this? Who knows? Mm-hmm. That's to be looked at. Yeah.
If people wanted to learn more, how do they reach you? What's an appropriate way for people to reach you? Like, let's say even a patient partner wanted to reach you to learn more about this so they could spread the word. Do you have a social media presence or anything like that?
I'm bad that way. No, I don't.
Okay.
But I'm on WhatsApp through you, Lawrence, thankfully, through the wellness connection.
Okay, so reach out to me and I'll connect you to the
yeah, until I figure that completely out, then yeah, that'd be good.
Sujatha, do you have any other questions or curiosities about Civility?
I'm just waiting for the spread. I have so many ideas of where to bring this to, but I think looking at the TED Talk and maybe starting with that when I'm engaging with like different teams, I think that might be a great start for me. But I'm going to be waiting for that experiential package.
Right. Well, and this is music to the operations side of the equation too, music to their ears, because you can imagine if staff aren't calling in sick as much and absenteeism is reduced and people are staying in their jobs, you know, a whole piece about recruiting and training and, you know, the expense and time that's involved in that with that is reduced. So they're all in as well, right? Yeah. I read somewhere that Fortune 1000 companies spend on average 7 weeks of the year of the work year dealing with repairing social relationships after bad behavior. So that's like 13% of their time away from more, you know, core activities, more important activities. So
yeah, I always try to speak the admin language: retention, recruitment,
exactly.
well-being, which equals better quality of care for our patients. And I think, you know, they can never say no to that, at least in my mind.
For sure. Yeah. Yeah. Well, thanks so much.